Well, the surge in COVID-19 cases has reignited the debate over lockdowns in a number of provinces and who should decide when to impose them and on what basis. Raywat Deonandan is an epidemiologist at the University of Ottawa, specializing in global health. Professor Deonandan, good to speak with you again. How satisfied are you with the measures now being taken in provinces that have these surging cases?
I'm not particularly satisfied because clearly they're not working, right? And we can base that on things like the reproduction number, the test positivity rate, and whether or not the hospitals are overflowing. And in many parts of the country, the hospitals are reaching capacity. So it looks like something more has to be done.
There are raging debates when you talk about something more has to be done, raging debates in these provinces about what the criteria should be for shuttering businesses and imposing tighter restrictions. So what do you look at now in terms of deciding what other restrictions are needed to bring this second wave under control?
It's a tough question. First of all, this is not up to epidemiologists and doctors to decide. This is for the people to decide based upon whatever values they have chosen. So we look at some indicators, like, as I mentioned, the reproduction number and the percentage of tests that come back positive, but also, is the healthcare system being overwhelmed? And we look at the opportunities for super spreading environments. They tend to be places where people cluster, like bars and restaurants and wedding banquets and karaoke bars, any place where people get together for reasons that aren't necessary. So if you can take those off the table, at least temporarily, you've got a good chance of shortening transmission.
That does raise the question of, even if you do put measures in place, part of the problem here, isn't it, is that people just aren't following the measures that are in place. They're choosing to ignore what's being asked of them and putting others at risk.
That's exactly right. I'm fond of saying that public health is the art of the possible. And what's possible is dependent on what people will tolerate and go along with. So, is it possible for people to voluntarily self-restrict their socialization? It's unclear. People have tried it and it's failed in some places and succeeded in others. Is it possible to compel them to self-restrict? Possibly, but that comes at a social and political cost. So it's a tough call. But there are tools on the table we could use. I mean, there is the short-term lockdown, the circuit breaker. There is the suppression technique, a longer-term lockdown. There's a mitigation where we just, deploy hand washing and mask wearing. Or there is a COVID-0 approach where we drive cases to an extreme minimum. All of these options are with us, including possibly a saturation testing option where we just test everybody and quarantine the ones that test positive. So we have to decide as a people which solution we want, especially now that we've seen the vaccine. So we've seen that a solution is around the corner. We just have to find a way to wait out the long winter until the solution arrives.
The Prime Minister said again today these more restrictive measures, if they're implemented, are better left with provinces. He dismissed again the use of the federal government's emergency powers to impose any stricter measures. Do you support that approach?
It's a tough call. I think there's a role for the federal government here. At the very least, to start the process of a national conversation to choose the outcome that we're interested in. Is the goal here to save the healthcare system? Is the goal here to protect lives? Is the goal here to prevent long-term morbidity? What is the goal? And until we can all agree on that goal, we're going to have this heterogeneous mosaic approach, which is not useful. The principles of containment have to be uniformly applied across the nation, and that means federal leadership.
You touched on it. A lot of people pointing to vaccines and how that will help us turn a corner to get past the pandemic. Do you share that confidence and optimism, and how long do you believe it'll be before all Canadians can get a vaccine? What's the time frame we're looking at here?
I'm very optimistic about these vaccines, extremely optimistic. We're going to have 2 or more viable candidates in the field sometime next year. So the 2 leading candidates, Pfizer and Moderna, have both applied or will soon apply for emergency use authorization in the USA, which means that in that country, they're going to have several million doses to deploy by the end of the year, probably. And so in the USA, they'll probably get most of their citizens having access by sometime in the spring. Here in Canada, I anticipate we're going to have access to it in the late Q1, possibly early Q2, and our healthcare workers and most vulnerable are getting it by next spring. So for the rest of us, end of next year is when we should expect full inoculation.
All right, Professor Deonandan, always good to talk to you. Thanks for your perspective again tonight.
Thank you.